Welcome to episode 27. Today on Beyond the Thyroid podcast, we are going to discuss what drives other physicians besides myself to rethink their entire approach to medicine. That's exactly the kind of transformation we explore with today's guest. I recently sat down with Dr. Ruth Odoi, a board-certified internal medicine physician who transitioned from conventional medicine to an integrative and functional medicine approach. Dr. Odoi specializes in women's and metabolic health. She is the founder of Oasis Women's Functional Medicine in Rochester, New York, which she started after becoming disenchanted with a system that prioritizes pills and quick fixes over true healing. She trained in internal medicine at Stanford Hospital in Stamford, Connecticut, and holds an MD from Ross University, a biochemistry and molecular biology degree from University of Massachusetts at Amherst, and an MPH, Master of Public Health, from Tufts University. She shares insight on women's health via social media on Facebook, Instagram, and YouTube under the handle Oasis Women's Functional Medicine. In this discussion, we explore how functional medicine informs her practice and transforms the lives of her patients. We dove deep in how a classically trained physician is in an ideal position to take advantage of the innovations offered by functional medicine without being seduced by the more frankly non-scientific aspects of the field. These tend to be espoused by various functional medicine practitioners, such as chiropractors, who are practicing outside their chosen field of study and don't have sufficient medical and scientific backgrounds to be able to evaluate the effect of these treatments. She particularly focuses on those who are struggling with lifestyle diseases such as gut issues, chronic inflammation, hormone imbalances, and polycystic ovary syndrome. If you've ever wondered what's available beyond prescriptions and symptom control, this episode might change how you see your own health. So let's dive in. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. I have a really exciting announcement. Because up to 50% of people who suffer symptoms of low thyroid, the low energy, the weight gain, the gut problems, the thin hair, dry skin, will be told by multiple providers that there's nothing wrong with their thyroid before they get a diagnosis because they have normal TSH, I am going to build a new offering in my practice that I'm going to call the Thyroid Checkup. Because this circumstance is so discouraging and frustrating when you know you don't feel like your normal self. I know because it happened to me and hundreds of my clients. So if that's you, what you need is access to advanced thyroid lab testing and analysis by an experienced and qualified specialist who goes beyond guidelines-based thyroid care to help you finally know where you actually stand in regards to your thyroid. This will be a small group program with direct access to me, where I'll help each person get answers about their thyroid status and next steps to recover their energy and vitality. So if you want more info about this, go to www.danagibbsmd.com/checkup to get the earliest notification when I open this program. It's going to be soon, so don't wait. Hi, everybody. I am excited to be back with you today with Dr. Ruth Odoi. Dr. Odoi is a functional medicine doctor. She did her training in internal medicine, but has transitioned over to the dark side. So welcome, Dr. Odoi. It's so nice to have you here.
Yeah, thank you so much. I am so excited to be here and talking to you. I know I've been listening to your podcast and I'm a big fan with your approach to thyroid and being a physician myself, it's I know the TSH has the broad range, and when someone is normal, we don't do more after that. So I'm very excited to be here on your podcast and to share with your listeners and your patients what I do and to have a
That's
conversation.
that's going to be so much fun. So let me just get right into it and say for the listener and for me, because I don't really know what is the difference between conventional medicine and functional medicine. And of course, you know both, having come from a traditional medicine background. So I'm excited to hear what you're going to tell me.
Yeah, thank you for that. So I will start with a story. So I've been a hospitalist now for 7 years after leaving residency. And so I'm always in the hospital setting. I take care of really sick patients. And so I see the end of or the end of our healthcare system where every system put in place has failed. I see the end of it where the people are now actually sick and they are in the hospital. So one of those days, I was rounding, and this guy, the nurse came over and handed him maybe 10 pills. He's
Oh,
not
wow.
brushed his teeth, no breakfast, nothing, and he was handed 10 pills. And guess what? It included Synthroid. So,
Mm.
she hands him the pills, and, the guy looks at me very deflated and was like, "So I have to do this for the rest of my life?" And I said, "Well, it looks like that's the case. And he's like, "So what if I decide to stop? What will happen?" And I said, "Well, you have all these medical conditions, and they could, they can get worse, and you could end up in the worst situation than you are in right now." And then he said, "Well, just 2 years ago, I wasn't on any medications, and it looks like every visit I go to see the doctor, I get another prescription." And so I, reviewed all the medications with him, and he, it's like one after the other. It looks like this side effect happened, so they put him on this, and then this happened, and then they put him on another medicine. So now he has all these medications. So for me, that was like a pause, like, are we doing the right thing? Because he's still sick. He's taking all these medications. I asked him, like, how do you feel every day? He's like, I feel like crap and I just want to quit. I
Mm.
just want to stop doing all of this. So
Mm-hmm.
that was like a pause for me. And so I started thinking of ways, how can I de-prescribe? How can I reduce pill burden for patients? And beyond that, how can I make them feel better while I de-prescribe and reduce their pill burden or reduce the number of medications they have to take every day?
Mm-hmm.
So that led me down the path of integrative medicine. And I even considered just going to the complete dark side and just going to herbal medicine, because I find some patients are more open to herbal medicine and supplements and that stuff. So I started doing some research, and I'm a biochemistry major. So once I
Mm-hmm.
started reading about functional medicine and their approach to root cause and just looking at enzymes, and I saw all these like biochemical diagrams that I'm used to looking as an undergrad in biochem. I really
Mm-hmm.
it it really drew me to functional medicine. So to answer your question, the main difference with functional medicine is we look at the root cause of illness and try to look at things like chronic inflammation, the gut, the gut flora, to make sure that that's well balanced, to look at hormones, at that level of testing to make sure all these things are balanced. And we believe that with treating things at that core root, we are able to overcome all these chronic medical conditions, which all fall into the spectrum of metabolic diseases, obesity, diabetes, high blood pressure, high cholesterol, all those things. So, long story short, I don't know if that answered your question.
Well, no, that's a really good start. So basically what you're saying is you're looking for the underlying triggers. Why did someone get into a situation where they need to take 2 blood pressure medicines and a blood sugar lowering medicine and an anti-inflammatory and some kind of kidney disease medicine and this and that and this and that? It's like, okay, can we stop that before it gets to a point where you have to be on all that stuff? That makes perfect sense to me, because that's kind of where I'm at as well. And I don't call what I do functional medicine, and I haven't gone to a functional medicine fellowship or a course or anything like that. My background was in surgery, and we kind of really had a do what works kind of an approach. And it's like, I don't know, if you've got an infection, you can't just put a Band-Aid on it. You have to get rid of the infection. You've got an abscess, cut it open, wash out the infection, heal it up, sew it up, get rid of it. And if you got that infection because of low blood flow, what can we do to fix the blood flow? And, if you have stomach problems all the time and it's because you're allergic to corn, I don't know, something like that. Let's figure it out and get rid of what's causing the problem. So that makes perfect sense to me. There are certain practitioners that I've come across, and certain patients also, who are like, "Ooh, I don't want anything that's a pharmaceutical." And I'm like, "Well, let's talk about that. So you're okay with taking a supplement that has God knows what in it and is unregulated and might have poison in it?" Because that's the history of basically patent medicine in the US, is for them to put stuff in there. They don't even know what it's going to do to you, but it's considered not a medicine, therefore not regulated, therefore, that bothers me. Whereas a hormone that's identical to what is in my body to start with, or your body or whoever's, if your body's not making that anymore, and we can't make it start making that again because your thyroid gland has been damaged by an autoimmune disease, or because your ovaries have ended their lifespan, I see nothing wrong with using FDA approved version of that if it's going to be the thing that's best, if it's the most identical to what's in my body. That's kind of where I'm at. But at the same time, I've got people who are like, "Oh, well, that's not natural." And I'm like, "Yeah, it's synthetic, but it's identical."
It's as natural as it gets, because it's in your body and you are replacing it because there's a process that has, come in to take over, or a process that's causing the gland not to perform at its peak. So I agree. And, I think what functional medicine, or there's some practitioners of functional medicine who are not physicians or DOs or naturopathic doctors who do functional medicine, and it's very much like a protocol-based approach, where it's like, well, if XYZ, then you do this protocol. And people that, without the training in medical school or residency and all of that, it's very protocolized, if it's a word. So it's like a protocol.
Absolutely.
Whereas,
it's giving something without understanding what it's actually doing for you or to you.
Exactly. And so that's where I think that I would say to your viewers or your listeners that it matters who you go to for this care. It really matters. And it makes a difference, because whenever I see someone, believe me, if their blood pressure is elevated and it's to a point where they could get a stroke, my first approach, like you mentioned, would be to put a Band-Aid on the wound and say, "Hey, we need to start you on this blood pressure medicine to get it low, but I want to continue working with you to get to the root of this high blood pressure so we can get it down. And eventually my goal is to take you off of this blood pressure medicine. So then I'm applying, my physician brain, but in a very integrative, patient-centered manner where they are being protected from further effects of this chronic disease, but also I'm looking at what is causing it and how can we get you off these extra medications if you don't need them.
Sure, absolutely. I'm just going to give you an example of that I really like that has to do with thyroid and something I see pretty frequently. And that is somebody who gets put on a beta blocker. And there are some reasons why a beta blocker is the best and or only drug that's helpful for what condition you have. But there are a lot of conditions like migraines. People get put on beta blockers for migraines. People get put on beta blockers for routine essential hypertension, which, essential hypertension to me is like, that's a gold mine for digging in to find out what caused essential. It didn't just come up for no reason. It came up for a reason. But if you put somebody on a beta blocker, it blocks their ability to produce T3 from the thyroid hormone that comes out of their thyroid gland. And so you have now created someone who is going to feel tired, sluggish, hair falling out, all the hypothyroid symptoms, and their TSH is going to look normal and their T4 is going to look normal. So by the protocol, by the guidelines that you and me as traditional medical doctors were trained to follow, we don't look at that and say, hey, you have a thyroid problem. But I look at that person and I say, yes, you have a thyroid problem and it's being caused by this medicine that you're taking. What can we do to switch you to something else that works to control whatever it's supposed to control while getting your thyroid back on track? Because if they're taking it for migraines, let's figure out why you got migraines. Let's stop whatever it is that makes you have migraines and get that under control instead of just putting a Band-Aid on it.
Absolutely. And for me, the draw in functional medicine is also the approach to, using food as medicine and looking at the different phytonutrients in food and how we can use food as medicine, like literally figuring out that. And also, like you mentioned, if the migraine is being brought on by stress, how can we regulate our stress? How do we address stress in our lives so that we can avoid these conditions so we actually don't need to take any medicine and then suffer side effects and require more medicine to fix the side effects that we are suffering from. So
because of the medicine that we took in the first place. No, that's funny that you would bring up stress, because stress is one of the number one topics that I help people deal with. And and because stress is funny. Stress is something that can be anything from my cat died to, oh my gosh, a guy just chased me down the back alley with a knife, to you know what, I can't afford to make the house payment this month. It's not like what our ancestors did, where somebody just attacked our tribe and killed half the people and we're going to starve to death because it's winter or this or that or the other. Your stress system, with your adrenal glands is like a carpenter who only has a hammer.
Yes.
The only thing that your stress system, your stress response, is only cortisol. And cortisol is meant to help you survive a famine or somebody chasing you down a dark alley. It is not meant to help you manage the stress of, okay, I got to go get another job because I can't make the bills this month. It's not meant for that.
Yes.
But it treats it as if it was exactly the same. So it raises your blood sugar. It makes you tired. It's crazy. And it damages your thyroid.
Correct. And it leads in, when you look at the pathway with cortisol, we have like the, the secretion of some E and, that enzyme, and it converts to epinephrine and norepinephrine, which basically constricts your blood vessel. And so if your blood vessels are constantly being constricted because your brain is perceiving a very dangerous situation, then of course, we can see how stress is directly linked to high blood pressure and diseases that affect your blood vessels. So that's, I'm looking at things in a very holistic and well-rounded approach. I'm not necessarily looking to sell people a protocol or sell them some supplements, but I'm looking at it at the very biochemical level. And that's why with me as a biochem major, I'm like, oh yeah, I remember learning about this cycle and seeing the enzymes and the different nutrients or minerals that are required for these enzyme function to actually happen. I think one unsung hero here is magnesium, and it's sort of involved in a lot of different reactions. And so in conventional medicine, usually if the magnesium is above a 2, it's like they are sufficient, but are they really? If they need magnesium for different enzymatic reactions in the body, do they need more? Yeah. So those are the questions that intrigue me with functional medicine.
Yeah, exactly. Well, magnesium is funny because I just assume that people who come to me are deficient, and I just say, here, you're taking magnesium, so go for it.
Yeah. And
I just assume they're not eating enough vegetables and they're not getting enough magnesium. I'm just like, here, you need to take magnesium. That's it.
That's it. Yeah. I hear you.
Yeah. What are the other main conditions or the main root causes that you see for chronic diseases that normal traditional doctors don't pay attention to?
What we see is a lot of gut function or meiosis,
Okay.
because as you get older or as you just go through life, if you take antibiotic for 5 days or 3 days for any infection, you've disturbed your gut flora. And those shifts alone we see can set the stage for worsening inflammation and also exposure. The gut flora being disorganized or disrupted can often lead to the leaky gut syndrome that we sort of talk about in traditional medicine. But that leaky gut then opens way for autoimmune diseases. We see that in terms of like chronic inflammation and also plaque formation as far as heart disease and high cholesterol. So one main thing is the gut. So that's something, you are what you eat, and it shows up in how your whole body functions. And so we do a lot of work on the gut. I think that's where we all start from, is to make sure that we have a balanced gut, and then we go on from there.
Yeah. So along that line, where would you start with somebody that comes in and says, hey, you know what, I'm bloated, I'm constipated, I don't feel good, or I just hurt all the time, I just hurt all over all the time? How would you start?
So I usually start with like basic blood panel. We look at a CBC, we look at iron studies, we look at your thyroid panel, like a full thyroid panel, TSH, free T4, T3, the whole thing. And one thing I do with my patients is I have them do a detailed questionnaire. And based on the answers and their scores in different body systems, I prioritize which systems that I should focus on. And so if the initial blood work is showing anemia and all these things, I try to correct what I can see before we go to the gut. And we do the stool testing, we look at the microbiome data for the person, We see the ratios between good and bad flora, make sure there's a good balance. We look at parasites. So we look at the whole thing. It's an extensive stool panel. And based
Okay.
on that, then I make recommendations of which probiotics that I want them on. But if someone
Got it.
said, listen, I just want a general probiotic, they have formulations for a general one that you can start taking, or foods that you can eat that will increase your give restore prebiotics, postbiotics, and then the probiotics. So it's like a whole spectrum of gut work that we do. So my process is usually, it takes time, by the time we do the general blood work to see what's glaring at us. Like if you have kidney disease or there's something glaring, we have to fix that first before we go to the root of it.
Yeah. Yeah.
Yeah.
So if you suspect food sensitivity, say, for example, so you think, maybe it's not celiac. I mean, celiac's something we can do an easy blood test and we're like, yeah, you definitely have celiac. What do you do when it's not something that's glaringly obvious like that? But you say, you know what, I really think you have a food sensitivity. What do you do?
So what I do is we talk about it and we discuss an elimination diet. So for at least 3 weeks, I ask patients to refrain from dairy, gluten, peanut, very highly allergic stuff, soy, coffee.
Oh my goodness.
I know.
Don't take my coffee.
Well, I used to be that girl. But roasted dandelion root actually really helped me when I did my first elimination diet. I started drinking that tea. It's roasted dandelion root tea.
Oh my goodness.
It
Never
has
heard
a
of that.
very rich flavor like coffee. And with drinking that and drinking a lot of water, I did not get any withdrawal headaches. And, by the third day of doing the elimination diet, my focus was so good that I haven't gone back to coffee on a daily basis. Yeah,
Yeah. Isn't that cool?
it's totally doable, and I think once you put yourself through that elimination diet for 3 weeks, you start to feel better. A lot of the bloating goes away, a lot of just the discomfort in my stomach goes away, and up to now I still don't have dairy and I don't have gluten and I don't drink coffee. Like if I go to an event and they are serving coffee, I'll have like a cup just to socialize, but it's not something that I need every day when I wake up.
That's great.
The elimination diet is very good once you can stick to it. It's tough in the beginning.
Yeah. Well, I mean,
no processed food.
Yeah. Do you find that some people are able to go back to eating gluten or dairy, or is it mostly just once you're off of it, you need to be off of it?
Oh, some people can go back to eating gluten and dairy, but it's usually a good eye opener for people because once you do it for 3 weeks, then we start reintroducing the foods. And as we reintroduce the different groups, the patient can tell, okay, I felt this way when I wasn't having any dairy. Now, once I started the dairy, I feel this way. And so that process alone would advise the person like, okay, do I just avoid this and keep feeling great, or do I reintroduce it? So it becomes like a personal decision for the patient depending on how they feel once they start reintroducing these food groups.
Okay. Very interesting.
Yeah.
So what other conditions does functional medicine do way better than traditional medicine? Tell me about mold illness, for example.
I am not a mold expert. I think
I
like
see.
with every field, we have people who niche down and we have mold experts in functional medicine, and we have Lyme disease experts, and so my passion is metabolic diseases
Got it.
and trying to help women to not get to a place where they now have full-blown diabetes or full-blown high blood pressure or full-blown, you know, hyperlipidemia where they need to go on cholesterol medication. So that's where really my passion lies. And I think a lot of the metabolic diseases are linked with female hormones once they start in the slow perimenopause age. Once those hormonal changes are starting, I think that's when we see a rise of the metabolic diseases. So that's really where my passion lies.
Cool. Okay.
Yeah.
That's me too. that's really that's 90% of what I do, that and thyroid.
Yeah.
So very, very cool. So tell me, this is one where I get so frustrated with traditional medicine, and that is PCOS and so-called estrogen dominance. Because, if you go to a gynecologist and you say, I have, and they examine you and you have cysts on your ovaries, you have PCOS, here you have to take a birth control pill.
Yes.
And that drives me berserk a little bit, because it kind of misses the point. Because in what I was taught and in my experience, PCOS is a metabolic disease. It's insulin resistance. And it's because of the high insulin levels, you then get high levels of testosterone, or you get to high levels of dihydrotestosterone, low testosterone, high dihydrotestosterone. And that's what causes most of the acne and the PMS symptoms and all of that stuff. So just curious what the functional medicine approach is to PCOS.
I would approach PCOS the same way you do, which is getting to the root of things, the hyperinsulinemia. How do we address that? And I would approach it from the gut. We start with the gut, make sure things are balanced there, and inflammation in the body, and then keep working down that route. But how do you, I guess, approach it, or how do you, if there's someone with PCOS, when they come to you, how do you approach it with them?
Sure. Okay. So somebody would come to me and they would say, I'm gaining weight. I can't stop. I have acne on my back. I have acne on my chest. Under my chin. Starting to grow hair on my chin. My periods are awful. I bleed really heavy. They're very irregular. The GYN wants me to go on birth control pills. I really don't want to. And we can talk a little later about why birth control pills for anything but controlling pregnancy is a bad idea. But so I start with that person, and I do a set of metabolic labs, and I will have them do a fasting insulin level, which, it's odd to me that traditional medicine does not, as a matter of routine, do a fasting insulin level, because it'll tell you right away, oh, it's over 7. Okay, you have insulin resistance. Boom, that's all there is to it. But you can also do a calculation with your blood sugar called a HOMA-IR and get a decent idea as well. And then if you're still not sure, you can do an oral glucose tolerance test where you have them add insulin to the blood draws. So you're not just checking the blood sugar, but you're actually checking the insulin levels. And you can watch the insulin, and instead of going up to a high of 35 or 40, it'll go up to 80 or 100 when you feed somebody a big splot of glucose. And if you watch that over 4 hours, and I do 0, pre-sugar, and then 30 minutes, an hour, 2 hours, 3 hours, 4 hours, and you can watch it, and their blood sugar will go up, 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 and then it'll come down. And then at hour 4, that's when they'll have the sugar crash. That's when their blood sugar will go low, because the insulin that they released was now too much for the amount of sugar that they had, and it lagged, and boom. And I'll just tell them, it's like, look, you need to go on a low insulinemic diet. And that's mostly no sugar, no starchy carbs. If you're going to eat starchy carbs, it needs to be very, very complex carbs like whole grains, whole, like steel cut oats, things like that, that release their sugar really, really slowly into your body.
Slow, yeah.
And that's the first thing. But the second thing I do is that I'll have them go on something called saw palmetto, which is an herbal medicine.
Yeah.
You can't give it to someone who's trying to get pregnant, of course, because it has some birth, it can cause birth defects.
Birth defects, yeah.
But if they are not immediately intending to get pregnant and they're willing to use an alternate birth control form, then I'm very happy for them to use that, because it stops the acne, it stops the PMS, it stops a lot of these bad symptoms while they are losing weight slowly over time and getting used to the new way that they're going to need to eat basically for the rest of their lives.
I see.
So that's the big way I deal with PCOS. The reason I don't like birth control pills for PCOS is because birth control pills basically trick your body into thinking you're in menopause, and your levels of progesterone and your levels of estrogen go really, really low. And you need progesterone. I mean, this is another thing that I disagree with a lot of GYNs about. You need progesterone. Progesterone helps you relax. It helps you sleep. It helps you produce serotonin in your gut. There's so many things that you need those hormones for, and when you don't have them, you can end up with a perimenopause-like syndrome where you lose your libido and sex is uncomfortable or even painful, and there's so much more to it that is triggered by these, even the progestin only birth control pills will do this, and your body just goes, oh, I guess we're done. So that's kind of my PCOS thing is, look, this is a metabolic disease. You're going to have to control what you eat and when you eat, maybe even look at food sensitivities and that kind of thing.
Absolutely. So with that, I think as integrative medicine physicians, or those of us not doing the typical conventional way, I almost feel like you need to have some coaching and definitely some coaching training or approach, because it's very hard to tell someone to start eating differently. How do they stay motivated to continue with that diet? How do they learn? How do they relearn? So I find
and
that interesting.
How do you even know who to believe about what's right? For years
Correct.
and years we were told fat is terrible, don't eat fat, it's bad for you, blah blah. And now it's like, oh well, actually fat controls your appetite. Oh, fat doesn't raise your insulin levels. Oh, fat doesn't hurt your kidneys. All these things, and it's just like, okay, it's no wonder people have a hard time trusting doctors, because we say a different thing every month. It feels like it changes.
Yeah.
So it's just like, dang, it's tough. And you're right. You have to. This is the thing that functional medicine doctors in general, I think they and because we are not bound up in the insurance system where we have to see a new patient every 15 minutes.
That's right.
Or we can't pay our staff for the electric bill because the insurance reimbursement is so terrible. You do have to spend time, and you do have to coach, and you do have to go in and say, okay, here's what I see happening with you. What's going on there? What are the barriers? How can I help you figure out a new system so that this is easier for you to, and maybe it's something as simple as, hey, here's a recipe for this morning chia smoothie that will give you 20 grams of extra fiber that you weren't going to get ordinarily, or something like that.
Simple, yeah.
And just, and yes, part of that is what a nutritionist should do. But if a nutritionist is in an insurance-based system, they're harried and overstretched and underpaid at the same as
Yeah,
everybody else. And so it's
correct.
like, yeah, you have to get that training where you can get it. And if you can get it from a doctor and trust the information because it's from a doctor, then great. If you want it from somebody who's a health coach, then great. You get it where you can. And, don't take my word for it. Try it for 6 weeks and see if you feel better. And if you don't, okay, do whatever you
Then
want.
we can, yeah, 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 absolutely.
But anyway, so what about autoimmune diseases and inflammation? You mentioned inflammation at the beginning. So, what
Yeah.
does functional medicine offer for folks who have autoimmune diseases?
So for autoimmune diseases, the belief is that it starts with a leaky gut because a lot of your immune system lives in your gut. The mold and the gullet, they are
Mm-hmm.
the sorry, I'm using medical terms,
Sorry, will
but
you define those two for the audience? Will you
yeah,
just say what
so
those are?
those are just groups of immune cells that live in your gut, and they communicate with your general immune system throughout your body, but they are localized in your gut and they are part of your immune system. So it's because it starts with a leaky gut, and the cells with leaky gut, what happens is that once the cells that are lining your gut get exposed to toxins or to the main thing in the mainstream right now is the proton pump inhibitors or something like steroids, things that irritate your gut. Sort of
Mm-hmm.
opens up the gut lining cells. It leads to the leaky gut. And once there's a leaky gut, it means there's more, the cells have come apart, and now there's a big space for these molecules or whatever you are eating to get out of your gut system into the blood. But your blood does not recognize it, so it sees it as a foreign body and now mounts an attack, which then leads to autoimmune disease. So
Mm-hmm.
from that standpoint, we see that it's all mostly starts in your gut. And so
Mm-hmm.
functional medicine approach to autoimmune is really a thorough gut workup. We start with food sensitivities, stool analysis, organic acid testing, all those things basically focused on your gut. And that's how we approach autoimmune. And I know people who have been steroid dependent because of autoimmune disease who now are free and don't use the steroids after extensive work on their gut.
Mm-hmm.
Like,
And
yeah.
other than so let me make sure I understand. So there
Yeah.
are probiotics that you recommend that will replace the healthier versions of the bacteria
Correct.
that live in your gut. So that's one thing. And then there are certain foods that are healthy to eat and certain foods that are less healthy to eat that you should try to limit or eliminate. And what other things do you use? Are there enzymes? Are there herbal things that you use to help people heal up their gut?
So, like the overall, like broad overview, we do a lot of vitamin D supplementation that
Okay.
helps. And then prebiotics, which you find in things in fermented foods like
Mm-hmm.
sauerkraut, but you have to be careful with sauerkraut because of the amount of
I hadn't
salt
thought of
that
that.
can
It's
be
very
in it.
salty. Yeah.
It's very salty, so you may want to extract the brine, but have it in a very diluted fashion. You still
I
get
see.
the prebiotic aspect
Mm-hmm.
of it without the salt load, and kefir, non-dairy yogurts, all these things have good flora and prebiotics that will help replenish your gut. Yes.
Mm-hmm. Mm-hmm. What is kefir? Just for somebody who's ignorant and doesn't know, what is it?
Oh, kefir is it's a form of yogurt. You usually will see it in the yogurt aisle.
Okay.
It's spelled Kefir.
Mm-hmm.
Yeah.
And it's just a fermented dairy product, basically, or something
Correct.
like
It's
a
a
dairy product.
fermented, yeah, dairy product that has a lot of prebiotics
Okay.
that and the probiotics that
Got it.
help with your gut. It's
Okay.
very good if you have issues with bloating and alternating bowel
Okay.
habits.
Do you do pH testing to see if somebody has low, I don't know, digestive enzymes or low hydrochloric acid in their stomach or any of that kind of stuff? Do you do any of that? Or is that all the GI doctors that do that?
If it comes up, I think the organic acid testing gives us some insight into that. So
Okay.
we typically don't look at the pH unless it's like we've done all the basic stuff and there's still something, then we would probably refer you to a GI functional person who can look more and do that level of testing, but it's not something that I routinely do.
Okay. Okay.
I think functional medicine, I think it's very practitioner dependent.
Mm-hmm. Yeah,
I
it's like
think
everybody has their pet thing that they like to work on. It seems like
correct.
you
and
mentioned
and
you
you
mentioned Lyme disease, for example, and Lyme disease is not really something we have a lot of down where I live. Where the
yeah.
ticks we have are different. I don't know.
Yeah,
So we don't have a lot of Lyme disease down here, but I know it's pretty bad up in the Northeast where you live.
true.
So anyway, one other question that I did want to ask you about was intermittent fasting, and
Hmm.
if you find that plays a role in nutritional plans for your metabolic health patients.
Um, so intermittent fasting is something that I have done and I have gotten good result from
Mm-hmm.
personally. And so I recommend it, but I would have to know the person. I would not just recommend it for everyone because you also want to be careful if someone has a propensity for disordered eating.
Yes.
You don't want
Yes.
to
Yes. Yes.
blanket recommend it for everybody because you don't know what someone struggled with in the past, and so yeah, so it's a very touchy subject where, if I know that there is no suspected disordered eating pattern, then intermittent fasting, I think helps. It really, the ketones that come out as a result
Mm-hmm.
will increase mental clarity and also
Mm.
increase your performance in terms of your thinking. Because anytime I have done intermittent fasting, my thinking and the way I make decisions is very different. And I think it's from the ketones that are produced. And then
Wow.
also in terms of immunity and clean up your system, the autophagy that happens with fasting also goes
Mm-hmm.
a long way in terms of body cleansing and
Mm-hmm.
and just increasing your immune strength, because as a hospitalist, I'm always in the hospital. I'm always with germs, and so I use these techniques to stay healthy while
Mm-hmm.
working. And I have young kids who go to, school, so I
Bring
do
home
a lot
nasty
of
bugs every day.
bring all the time. So I find intermittent fasting helpful in mental clarity and
Mm-hmm.
also strengthening your immune system because of the autophagy that happens. But
Got it.
I'm very cautious of who I recommend it for.
Okay.
The other thing is that as women age, there is like an increased need for you need to have more protein. And so if you do
Mm-hmm.
a lot of intermittent fasting, I think you lose out on the opportunity to have enough protein for the day. You know what I mean? Because if you are
I
eating just six,
absolutely know what you mean. I do
so
know what you
yeah,
mean.
so if you are
Yeah,
eating
I
only
mean,
6 hours in a day, how much chicken
How
can
much
you
protein
eat
can
to
you
meet
possibly eat?
possibly pack in the
No,
6 hour period.
yeah, no, I agree
So
with you. I have found that
so
for my own personal health, it's just like, you know what? I could call it intermittent fasting, but I have to eat breakfast and it has to be a high protein, it's either eggs or some kind of meat or, some kind of, I don't know, quinoa,
yeah,
something like that,
something.
chia seeds for sure. I have to have that or I literally can't get enough protein in a day. And I'm doing my best as an older postmenopausal woman. I'm doing my best to work out and lift heavy. And it's like, man, if I go to the gym and I didn't eat something first, I am in trouble. And I
Yeah,
go early.
and
And I go early. So this is like, oh, I have to make myself eat something before I go to the gym in the morning, So
so
anyway.
so those are the two factors. It's like the protein need, and then disordered history of disordered eating in the past that
Mm-hmm.
will be the only thing. But they have these Prolon. I don't know if you know of the product. It's called Prolon fasting, and it's a product line that helps people who want to fast but also don't want to miss out on the protein loss.
Mm.
So it's like packets that you drink throughout the day,
Mm.
basically to replenish your electrolytes and your minerals as
Mm.
you do your fasting, so you don't lose these things in the process. Because what happens is you are drinking a lot of water. So
Mm-hmm.
even before I found out about Prolon, I would use a little Himalayan salt under my tongue with
Mm-hmm.
the fasting, drink lots of
Drink a
water.
lot of water. There you go.
Yeah, because the drinking of water, your sodium imbalance and the
Mm-hmm.
weakness and feeling kind of tired in the beginning. But by the time you do day 3, your energy and your brain, your mental focus is so good that coming out of that
Interesting.
ketogenic state is very
Mm-hmm.
sad, but I also know I can't continue with.
You can't keep going. Yeah, no,
Yeah.
that's so true. All right. Well, we have been going for a long time, and I don't want to bore everybody too much. Give us before we go. Give us one main tip that you have people use to help them control their stress response.
One tip I think every day you should move. Some movement. It doesn't have to be in the gym.
Mm-hmm.
Move. I like to turn up my music and dance in
Awesome.
my
Okay.
office. So movement in any fashion, I
Mm-hmm.
think, is key. Even 5 minutes, get up, move. You know,
Yeah.
movement.
Mm-hmm.
That's the one thing I'll tell everybody. Move.
All right. So cool.
Yeah.
All right. Tell the audience how they can find you and where you are located in the world.
Yes, I am located in Rochester, New York. So that's upstate New York. And my practice is called Oasis Women's Functional Medicine. Oasis, OASIS,
Mm-hmm.
Women's Functional Medicine. I am taking new patients or clients, and I'm very excited. I am hoping to step out of the hospital medicine space and do this on a full-time basis. So I'm excited.
Fantastic. So
Yeah.
do you do virtual visits as well as in person?
Yes. So I do all my initial visits in person, and
Mm-hmm.
subsequent ones can be done virtually or not. Yeah.
Mm. Do you act as your lady's primary care physician?
Not right now. I
Okay.
am hoping to expand my practice to have direct primary care
Mm.
so that we keep everything in the same place. But right now, because I work as a hospitalist, I can't guarantee that I will be there, as a PCP for urgent needs, because I
I
might
see.
be in the hospital working. So
Yeah, I get that.
that's the
So, yeah.
plan. Yeah.
Well,
to transition.
This is going to be great, and Oasis Women's Functional Medicine so needed, and it's going to be super good for my New York listeners and for yours. So this is going to be really, really good.
Yeah, if you know someone in New York.
Oh, I get asked all the time, who do I know in New York? And I'll be like, ah. So, no, this is wonderful. Anyway, all right, guys, thank you for listening. This is Beyond the Thyroid. And if you are looking for somebody in Texas to help you with your Hashimoto's, chronic fatigue, or thyroid symptoms that don't respond to the typical treatments, kind of come look me up, Dr. Gibbs at danagibbsmd.com. And I'll see you next week. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.